When we first started looking into this whole retinoschisis thing,
Hmm.
I gotta say, we were pretty blown away to find out that there are actually 4 different types,
Right,
and it's
right.
not just one condition.
Yeah, it's not like you just have retinoschisis. Like you might say something like you have a cold. There are
Exactly.
different types of retinoschisis. And
And they can really affect people in wildly different ways.
yeah, they do.
So that's something that we definitely...
Yeah, and it gets even more interesting when you start to look at the genetics involved,
Oh, yeah.
particularly with the X-linked juvenile retinoschisis.
Yeah.
It really highlights just how much our genes can impact our health. You know,
That's right.
it's not always something that's like super obvious or you can see from the outside,
Right.
but it's happening at a deeper level.
Okay, so I think we're maybe getting a little ahead of ourselves. Let's back up a little bit.
Sure.
For those tuning in for the first time, what exactly is retinoschisis?
So imagine the retina, and that's that lining at the back of your eye, and it's responsible for capturing light.
Right.
Imagine that like a piece of delicate fabric.
Okay.
And in the simplest terms, retinoschisis is when this fabric splits into 2 layers.
Okay. Like a little tear?
Yeah, like a small tear can form in your favorite shirt.
Gotcha.
And so it's that separation of those layers that causes the problems that we see with retinoschisis.
And now you mentioned the X-linked type.
Right.
Why is that one such a big deal?
So that one's a big deal because of how it's inherited.
Okay.
You see, this particular type is passed down through a gene on the X chromosome.
Okay.
Now, males have 1 X and 1 Y chromosome, right?
Okay.
While females have 2 X chromosomes.
Okay.
So a single mutation on that X chromosome is enough to cause the condition in males.
Oh, wow.
So it's much more likely for males to inherit X-linked juvenile retinoschisis.
So if you're male and you have a family history of this,
Yeah,
you'll definitely want to be extra vigilant about those eye exams.
absolutely. And that's where early detection can really make a world of difference.
For sure.
Because the earlier we can catch it, the better chance we have of managing it effectively.
That makes sense. Now, speaking of detection, how would someone even know if they had retinoschisis?
Yeah.
What are the signs?
So many people with retinoschisis, they actually experience changes in their vision.
Okay.
Some people describe it as losing their peripheral vision, like looking through a tunnel,
Oh, wow.
or they can see what's straight ahead,
Mm,
but not what's happening on the sides.
interesting.
Others might notice a decline in their central vision, like it becomes harder to focus on fine details.
Yeah, those sound like pretty significant changes.
They can be.
So if someone's experiencing symptoms like that, how do doctors diagnose it?
Right.
It's not like they can just look into the eye and see, oh, there's the split.
You're right. It's not that simple.
Right.
It's a little more high-tech than that.
Okay.
We have to rely on some pretty incredible technology to be able to see these things.
So how do they actually do it?
Well, one of the most impressive tools they use is called optical coherence tomography,
Wow.
or OCT for short.
OCT?
Yeah, it sounds very technical,
It does.
but essentially,
It kind of reminds me of like a medical tricorder or something.
it's kind of like that, yeah.
Like Star Trek.
It's like taking a 3-dimensional, super high-resolution scan of your eye.
Wow.
So they can actually see the different layers of the retina,
Okay.
and they can spot those tiny splits.
So they can actually see the split happening.
They can see it, yeah.
Wow, that's incredible.
It's like finding a hairline fracture in a bone.
Wow.
You wouldn't be able to see it just with your naked eye.
Right.
You need that specialized imaging.
Okay, so they use the OCT to actually see the split, but then how do they figure out what's causing it? Like, is it serious or not?
Right. So that's where they might use other tests too,
Okay.
like an electroretinogram
And what is that?
or an ERG.
ERG. Okay.
So that measures the electrical responses of the cells in your retina.
The electrical responses.
Yeah, so it's like hooking your eye up to a tiny EKG
Oh,
and seeing how well those cells are communicating.
that's wild.
Yeah, so it gives us more information about the health of the retina as a whole.
Okay, so using all of this information, the doctor then says, okay, this is definitely retinoschisis, or they rule it out, I guess.
Exactly. Yeah, they use all those tools
Okay.
along with their clinical judgment to make that diagnosis.
Gotcha.
And then from there, once we know it's retinoschisis, the next step is figuring out how to best manage it.
And I'm guessing the management, or the treatment, I should say,
Sure.
really depends on what type it is.
You're absolutely right. It's not a one-size-fits-all kind of thing.
Okay.
For example, with degenerative retinoschisis, which is more common in older adults,
Okay.
sometimes treatment might not even be necessary
Really?
if their vision isn't significantly affected.
So you just kind of leave it be?
Yet in those cases, it's more about monitoring,
Oh,
making sure things aren't getting worse.
gotcha. But for the juvenile form, early intervention is key.
Absolutely.
Okay.
Catching it early and managing it effectively can make a huge difference in preserving as much vision as possible.
So what does that management actually look like then?
So there are a few different options.
Okay.
One option is medication,
Okay.
and specifically a type of drug called a carbonic anhydrase inhibitor.
Carbonic? What? Yeah, I know it's a mouthful.
Yeah, it's a mouthful.
Carbonic anhydrase inhibitor.
Okay.
But basically, these medications help to reduce fluid buildup in the eye, which can be a problem in some cases of retinoschisis.
So for some people, just taking a medication can really help manage their retinoschisis.
That's right. In some cases, it can be really effective.
In other cases, they might recommend laser therapy.
Lasers in the eye, that sounds kind of intense.
I know it sounds a little scary.
Yeah.
But it's actually very safe and effective.
Okay, so it's not like they're shooting lasers into your eye.
No. It's very precise.
Okay.
It's a highly focused beam of light, and they use it to target and seal off any leaky blood vessels in the retina.
Like tiny little welders.
Exactly.
Patching things up from the inside.
Yeah, it's pretty amazing when you think about it.
It really is.
And then in some cases, particularly if there's bleeding in the eye, they might use something called cryotherapy.
Cryo, now that sounds intense.
That one uses extreme cold
Oh, wow.
to seal off the affected area.
So basically like freeze it?
Kinda, yeah. It's like a super-powered ice pack for your eye.
So we've got medications, lasers, cryotherapy.
It's amazing, right?
It's incredible how many tools are out there now to help people with retinoschisis.
I know, it's really come a long way.
It has.
And you know, the most important thing is early detection.
Yeah.
Regular eye exams are crucial.
Especially if you have any kind of family history.
Absolutely.
Or if you're noticing any changes in your vision at all.
Don't wait.
Go get it checked out.
Exactly.
Better safe than sorry, right?
Always.
Well, this has been so interesting.
It's fascinating, isn't it?
It really is. We've learned so much about retinoschisis today.
Definitely.
About how the eyes work, about these incredible treatments.
It's amazing what we can do these days.
It really is. It makes you think, we've talked a lot about genes.
Right.
And how they can be a factor in all of this. But are there other things that people can do?
Like lifestyle changes and things like that.
Yeah, exactly. Like, are there certain things that we can do or not do to protect our vision as we get older?
That's a great question. And it's something that researchers are still trying to fully understand.
Okay.
We know that genetics play a role, but there's also growing evidence that things like diet, exercise, even exposure to sunlight can have an impact on eye health.
Really? Wow. So much of this stuff ties together.
It all connects.
It really does. Well, I guess that's a whole other deep dive for another day.
Exactly. There's always more to learn.
Always more to explore. Well, on that note, we're going to wrap up our deep dive into retinoschisis for today. Thanks so much for joining us.
It was my pleasure.
And remember, if you're ever concerned about your vision, don't hesitate to reach out to an eye care professional.
Couldn't agree more.
Until next time, stay curious, everyone.